Hello, my name is Ana Vergel de Dios, and I'm doing a complete head-to-toe assessment for the Advanced Health Assessment class. I'm a nurse practitioner student at Maryville University, and this is CJ. He is my volunteer patient, and earlier I already asked him to empty his bladder. I also asked him to put on a gown, but for the purpose of this examination, he's going to wear his shorts. Also, I did a full set of vitals, which is within normal limits. I also checked or measured his height and weight. I also tested his visual acuity to test for the cranial nerve for using Snellen chart for distant vision and also near vision. To start, I'm going to do a general inspection of his skin, checking for color, uniformity, for thickness, symmetry, and also hygiene or any signs of lesions. Starting off with the head, I'm going to inspect his head, looking for size, shape, and symmetry on both sides, and also I'm going to palpate, check for any swelling, any pain, any depression. While I'm doing this, I'm also going to palpate his hair, check for texture, and also distribution. So far, it looks smooth, and there's no split ends. Moving on to the face, I'm doing inspection, general inspection of his face, the facial features, his eyebrows, his eyes, nose, lips, and ears, checking for their position, placement, check for any obvious abnormality like tics or drooping or facial droop or ptosis, which in this case, it looks normal. While I'm inspecting his face, I'm also going to test for cranial nerve facial. I'm going to ask you to clench your teeth and then close your eyes tight and then lift your eyebrows, stick out your tongue, puff your cheeks, and smile. Okay, and those all looks normal. That means it's intact. Moving on with palpation, I'm going to palpate his facial bones, making sure there's no pain or tenderness. While I'm here, I'm going to palpate his sinuses, starting with the frontal, any pain, and then the maxillary. And also, I'm going to check the temporal mandibular joint. I'm going to ask you to open your mouth, close. I'm checking for any pain or tenderness or clicking or popping. Any pain? Okay. So moving on with the eyes, starting with inspection, I'm looking at his eyebrows, check for hair distribution, the size, the shape, the orbital area, checking for any edema or swelling, and his eyelids, if there's any crusting or flakiness or any presence of sty, any drooping, and also his sclera. It should be wide. And I'm going to check his conjunctiva, if you can look up and look down, and it's pink, and I don't see any lesions or any nodules. While I'm here, I'm going to test for cranial nerves. First, I'm going to check his pupillary response. I'm going to shine this pen light. Just look straight. I'm checking for direct and consensual, direct and consensual. And they're both equal and round and reactive to light and accommodation. The next test is what we call the 6 cardinal fields of gaze. So without moving your head, I want you to look at the pen light, and I just want you to follow the pen light without moving your head. There you go. Down, up, up, and down. Very good. And also, I'm going to test, do the cover and uncover test. Can you hold this? If you can, just look at my shoulder and cover the one eye, and then uncover it, and then cover your other eye, and uncover it. So what I'm looking at is I'm looking at any eye movements or abnormalities. Finally, I'm going to check for red reflex using the ophthalmoscope. I'm going to start with this eye, right eye. I'm doing all my glasses. Just look straight. Okay. And then the other eye, just look straight. Look straight, look straight. I'm looking for the red reflex. And look straight. Okay. Next, and then I'm also going to palpate the lacrimal apparatus, making sure there's no excessive tearing, and it's good as well. Moving on to the ears, I'm going to inspect your ear, checking the auricles and its position and placement, checking for any deformities, and also I'm going to palpate the auricles. Make sure it's firm and mobile. There's no pain, any pain, no pain. And then I'm going to also do a series of tests to check for cranial nerve acoustic. First with the whisper test. I'm going to go behind you. If you can cover your right ear and repeat what I say.
Orange.
And then cover your left ear.
Baseball.
Very good. Okay, now I'm going to do a Weber's test. So I'm going to strike the tuning fork and tell me if you can hear it in both ears. Yeah? Okay. And then last is the Ryan's test. So I'm going to strike this again and put this here, and then you tell me when you stop hearing the vibration, and then I will move it in front of your ear, and you tell me again if you don't hear it anymore. Okay, ready? Hold on.
Who's got? Where's it gone?
Okay, and then the other ear.
It's gone. It's gone.
Okay. Air conduction should be twice as long as the bone conduction. And moving on to the last examination for the ears, I'm going to use the otoscope to visualize the tympanic membrane. For adults, you have to pull it back. You'll be able to see it clearly. And it's normally pearly gray. And the other ear, same thing, back, and pearly gray, and I don't see any perforations, so that's good. Next is the examination of the nose. I'm looking at the nasal septum, its position and its placement. I'm also going to palpate, make sure there's no deformities, no pain, no tenderness. With the pen light, going to look inside and to see the turbinate, and it's pink and moist. And also to check for patency of the nares, if you can occlude one of the nostril and take a deep breath.
Like what they?
Yeah.
Like my nose.
Take a deep breath. And then the other nose. Okay, so it's patent. Also to check for cranial nerve 1, you can check the sense of smell by asking the patient to smell different kinds of scent. Also for moving on with the mouth, I'm going to inspect first the lips, and then the check for any lesions, any sores, any ulcerations, cracks, and then show me your teeth. Check the teeth. There's no visual obvious cavities. It's white. There's no missing tooth. Open your mouth. Open. Checking for the soft palate, the hard palate, the uvula, which is midline, the tonsils, the tongue. You can move it up and to one side and to the other side. I'm checking for any lesions, and that's good. Any lesions, nodules, or any abnormalities of the mouth. Also, we can also do another cranial nerve test by checking for gag reflex or ah reflex. If you can open your mouth. Ah. Okay. So that's to check for gag or reflex. Moving on with the neck, starting with inspection. I'm inspecting and checking for the placement or the position of the trachea, make sure it's midline. There is no obvious enlargement of the thyroid. Also, the skin is smooth. Also, going to palpate first for the carotid pulse, one at a time. Also check for jugular vein distension. In this case, it's good, it's normal. Also palpate the trachea and the thyroid. Swallow for me, and you should be able to feel it with no problems. And then next, I'm going to palpate for the lymph nodes, starting with the preauricular, using the 3 fingers, preauricular, postauricular, occipital, posterior cervical, tonsillar, submandibular, submental, and then the cervical, deep cervical, supraclavicular, infraclavicular, and put your hands on the side, and axillary. Okay, and those are also normal as well. And I'm also going to check for active and passive range of motion. If you can put your chin to your chest and back, and put your ear to the side and the other side. Shrug your shoulder, and also to test for cranial nerve spinal accessory. If you can shrug your or push your shoulder up while I push it down. Very good. And that's normal as well. While I'm here, I'm also going to listen for any bruit, which is an abnormal finding of the carotid using the bell of the stethoscope. The other side. And the thyroid. Very good. Next is the upper extremities. Starting with inspection, looking at if you can put your hands up, checking for the color, the hair distribution, also feeling for temperature, and also for a check for capillary refill. It should be less than 2 seconds. Also going to check for brachial pulses, and that's good, strong, and radial pulses. Very good. Also, while I'm here, I'm going to check for reflexes. Just relax your arm, and you should see a slight jerking of the hand. And brachial. And moving on to the posterior aspect of the chest, if you can turn your back. And then if you can remove your shirt. Thank you. So again, we start with inspection. You wanted to look at the skin, the size, the shape, the symmetry, the respiration, the respiratory effort. Also, you want to palpate the spine. Make sure they're evenly spaced. Also, the costovertebral angle. Any pain?
No.
Okay, check for any pain. While I'm here, I'm going to palpate and check for tactile fremitus. You can say 99.
99, 99, 99, 99, 99.
Very good. And next thing I want to do is to do percussion and do it systematically from one side to the next, going down, and you should be able to and also the lateral aspect. You can put your hands on the side. Okay, thank you. If you can put your hands in the front, I'm going to check for expansion. I'm going to put my hand here, and then you can take a deep breath. Take a deep breath. So I'm looking at another one. The chest expansion, and my thumb should be moving symmetrically. Next is to check for diaphragmatic excursion, starting from the top, going down until you hear resonance to dullness, and then you mark that area, and then going up until you hear the dullness, and it should be 3 to 5 centimeters. And also on the other side, you mark the area, going up, and mark the area, and it should be within 3 to 5 centimeters. Next, I'm going to auscultate using the diaphragm. Take a deep breath. And then deep breath. Again. Deep breath. One more. Deep breath. Deep breath. And then the apices. Deep breath. And then deep breath. So we should look for any adventitious sounds such as wheezes, crackles, or ronchi. In this case, his lung sounds are clear. Next is the anterior aspect. You can face this way. The anterior aspect of the chest, beginning with inspection. Check for the size, the shape, the symmetry, the skin, the color, the respiratory effort, and it looks even and non-labored. And also if there's any use of accessory muscles, and in his case, he's breathing comfortably. I'm going to palpate, same thing as I did with the posterior aspect. Check for any pain, tenderness, any lesions, any deformity, and also I'm gonna check for tactile fremitus. If you can say 99.
99, 99, 99, 99.
Okay, and that's good as well. While I'm here, I'm also checking for the precordium, checking for any pulsation, heaves, or trills, and also for the apical impulse. And that's very good. Next is percussion. I'm going to percuss systematically. And that's very good. Next is auscultation. I'm going to auscultate it. First, take a deep breath. Again. Again. Very good. Again. 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 And again. Okay, and that's good. Next is we did the inspection, palpation, the auscultation. Moving on to the abdomen. If you can lie down. In checking the abdomen, you have to inspect first and then auscultate, and then you can percuss and do the palpation. First, we're going to do inspection of the abdomen. checking for contour, characteristics, any bulging. They're symmetrical. And listen for vowel sounds in the 4 quadrants. You have to at least listen for like 2 minutes to make sure you hear the vowel sounds. The right upper quadrant, left upper quadrant, left lower quadrant. And then while I'm here, I'm going to listen for bruits in the aorta. You should not hear bruit. Bruit is an abnormal result. The renal, the ilia, and the femoral. Very good. Next is light palpation. Again, you need to do it on all 4 quadrants, checking for any nodules, any tenderness, any pain, and move on to deep palpation. And also, you're cold. Check for, we'll do percussion. Again, percussing the 4 quadrants. And also for the liver border, starting up, going down until you hear dullness, and then it should be here. And for the splitting dullness, you can turn slightly to this side. And percuss, going down until you hear that dullness, and then until you hear tympani. Oh, that's good. After percussion, I'm going to do also a deep palpation here. Palpate the liver, the spleen, the left kidney, and the right kidney. And it should be non-palpable. Okay, you can sit up. You can put on your shirt. Moving on to the legs and the feet. First, you need to do, you need to inspect it and check for hair distribution, muscle mass, color, symmetry. Also, check for temperature and check for pulses. First, the popliteal pulse, the tibial pulse, and the dorsalis pedis. Here, you also want to do the check for reflexes, the knee reflex. Oops. And also the Achilles tendon reflex. And lastly, I'm going to ask you to stand up. And then if you can turn your back. Here you wanted to look at his cervical spine and lumbar spine. Make sure they're midline, they're upright. If you can bend your waist and check for curvature, check for any abnormalities. And in his case, it looks normal. And that concludes my head to toe assessment. Thank you.